Hi, everyone, to the Hospital Discharge Resources Training presented by HICPUF. The topics and resources discussed will not be an all-inclusive list of available resources. Please continue to reach out to the department through escalations for barriers that hospitals may be experiencing, or please continue to use current resources that you are using right now. We are trying to continuously review current possible avenues to reduce those barriers, so the more we know about them, the more the better. This training is a series of trainings, so please visit our For Our Hospitals landing page on the HICPUF website for details of future trainings. The link to that can be found at the bottom of the slide. You can also submit suggestions on topics for future trainings or areas where you would like more resources on. Information on how to do that will be at the end of this training. We value and appreciate your feedback as you guys are on the front lines, and we want to know how to best support you. Thank you in advance for joining us today. Our mission here at HICPUF is improving healthcare equity, access, and outcomes for the people we serve while saving Coloradans money on healthcare and driving value for Colorado. While we are working to meet the needs of those who are aging and have disabilities, we also want to align our work with preventing unintentional discrimination against those with disabilities and prevent unnecessary institutionalization. The goal is being met by providing training and additional resources directly to Health First Colorado members and to those who work with individuals and families who are at risk of institutionalization and rehospitalization. The department is currently working on projects directly with our community partners, nursing facilities, and Medicaid members and hospital staff to provide education and resources to help people with disabilities remain in the community safely if that's their choice. We understand that there is definitely situations and instances where individuals may need the care being provided in a skilled nursing facility or assisted living, and we want to support that as well. This training is just to provide information to help fill any gaps in education during the discharge planning process. We'll have a simple agenda today. First, we're going to review community partners. There is another training on that For Our Hospitals webpage that goes over more details about what these community partners do. Then we'll review different escalation process here at the department. We'll go over general resources. Again, this is not an all-inclusive list because thankfully there's a lot of resources out there. And then the last thing is this training request form. If there's any trainings you would like to see the department do, or if you guys would just like to receive more handouts to give to members during the discharge process, or just resources in general, or connections to more localized resources, please submit those requests to this form and we can get started working on that if applicable. So our first section, community partners. We're going to start reviewing the State Unit on Aging. The State Unit on Aging oversees programs funded by the Federal Older Americans Act and state funding for senior services. The unit provides assistance with funding the 16 local area agencies on aging, AAAs, to provide community-based services to seniors aged 60 years and older and their caregivers. They also oversee aging and disability resources for Colorado, also known as ADRCs, who support those 60 years and older, and they also provide support to those who are 18 years and older who also have a disability. ADRCs provide services utilizing the same regions as the AAAs. They, they both provide resources for Medicaid members, non-Medicaid members, and they provide information on how to navigate those two systems and to locate local resources. The State Unit on Aging as a whole provides general resources tailored to those regions that may include but are not limited to caregiver support services, nutrition support, legal assistance, long-term care ombudsman, which we'll talk about later in this training, and they can provide intermediate or advocacy for the elderly and or disabled, And then one more exciting thing that we wanted to mention is starting in the spring of 2025, ADRCs and AAAs will have regional resource documents that will list resources available in each region that hospitals can use to provide to their patients or help in discharge planning efforts. Now, some of those regions already have those resource guides available on their local website. If you don't see it on the website, please let us know and we can send you a copy of that just to help provide additional resources in your area to help with the discharge planning process. ACC, the Accountable Care Collaborative, Phase 3. Just some background information. The Department of Healthcare Policy and Financing, HCPF, created the ACC in 2011 to deliver cost-effective, quality healthcare services to Health First Colorado members and to improve the health of Coloradans. The ACC features regional accountable entities, RAIs, operating in 7 regions. Something to keep in mind that they're currently in phase 2, which has 7 regions. Excuse me. And then in phase 3, that will move down to 4 regions. And that will be effective on July 1st, 2025. The department has developed goals and priority areas for improvement and innovation intended to better align with our modernized mission, advances made by our sister agencies, and stakeholder input received over the past several years. Some of the goals for ACC Phase 3 are to improve quality care for members, close health disparities and promote health equity for members, improve care access, improve the member and provider service experience, and manage costs to protect member coverage, benefits, and provider reimbursements. Key changes for ACC Phase 3, like we talked about, would be moving the regions to only 4 regions to align with the Behavioral Health Administration, BHA, and additional care coordination requirements for RAIs, particularly in supporting transitions of care and collaborating with other agencies and community partners. For more information, or if you would like to dig deeper into the goals of ACC Phase 3 and what the RAIs are doing or able to do, please sign up for their newsletter. Community partners. Here is an overview of community partners that can support Medicaid members and hospital staff in the discharge process. Something to keep in mind is that the department is not prescriptive in identifying which agency should take the quote-unquote lead in communication and/or collaboration for members who have RAI coordination or care coordinators and a CMA case manager. However, each post-discharge team should identify who makes the most sense to be the lead based on service and support needs. Those community partners have been asked to collaborate with other active community partners with every discharge case. Everyone, including community partners and hospital discharge staff, should be reaching out to HCPF to support with delays, lack of responses and/or communication, any known gaps in service, or unavailable resources. We will talk about this in the following slides. Now let's cover the general overview of community partners. Please note that there was a training that goes over these roles in length that can be found on our For Our Hospitals HCPF landing page. There is also another training that specifically reviews how discharge teams can work with each community partner. Let's start with the RAIs. Their main function is to provide care coordination for medical and behavioral health services and with other CPs and HCPF. They navigate wait lists and service gaps, improve access to care, follow up after select hospitalizations, transition of care outreach, and high fidelity wraparound services will be available starting in Phase 3, which starts July of 2025. Now, case management agencies, they do the functional eligibility for HDBS, skilled nursing facility, level of cares, and other LTSS and long-term care programs, They do service plan development, which is individualized for each member. They do service and support coordination along with monitoring for service satisfaction and or changes to service needs. Transition Coordination Agencies, TCAs, support with moving a member from a SNF to community or from a hospital to a community when appropriate when there's barriers present. They facilitate a community needs evaluation to identify supports and services, and they can help appropriate housing and remove housing referrals and remove barriers to discharge. They can also connect appropriate members with life skills training, home delivered meals, peer membership when eligible. Now, ADRCs and or AAAs. They assist with long-term care planning, provides options counseling on Medicare options, Medicaid programs, and local resources. And they also empower individuals to make informed choices. The ADRCs and AAAs will also be the ones who house that resource guide. So you can also contact them if you're stuck or need more resources that are locally available. Awesome. The role of CPs extended. So we wanted to break it down further. So hospital staff, like you guys already are, please complete referrals for RAISE or to RAISE for any medical, clinical, or behavioral health services. Complete referrals for CMAs for LTSS or HCBS service coordination as appropriate. Then we just wanted to highlight, please complete PASSR level 1 if someone is going from a hospital into a skilled nursing facility. Then the RAISE, like we talked about, will process those referrals for any medical, clinical, or behavioral health services. And then they should also be coordinating with the CMA or other community partner regarding referrals to make sure there's no duplication. And then they are going to connect with HCPF or the department to receive support if there's delays or additional barriers. The case manager is going to set up the appropriate services. They're going to complete PASSR level 1 for anyone who is entering a SNF coming from the community. And then they will also coordinate with discharge planning needs with hospital team as needed. The role of the department is really to train, support, and monitor all of our community partners. And then we're also here to provide resources and guidance for teams that experience any barriers to discharging and or barriers in the community. And then we also manage all of the escalation requests. And then TCAs, they support discharge placements by sending referrals to HCPF you guys can send referrals to HCPF by utilizing the hospital discharge reporting form that we'll talk about in the upcoming slides. And then ADRCs and or AAAs provide ongoing support on local resources. They can also review Medicaid programs and Medicare options to discharging members, or non-members, I should say. And they can also provide options counseling on those resources that will also cover local resources. Referrals. So here's a link of how to connect with all of these community partners. There should be active referrals in the presentation slideshow that it will be on the For Our Hospitals website page. Essentially, you can contact your AAA's ADRCs, your CMAs, and your RAISE reasons per region directly. That is how you can send referrals to them. Another way to send referrals to the ADRCs, AAAs, and TCAs would be to complete the Medicaid transition to community request form, and that will go directly to your local contact agency that can connect discharging Medicaid members and non-members to those resources. And then we will talk about how to connect with HCPF in more details in future slides. And here are those slides. This is the escalations process in detail. For the most part, everyone is doing an appropriate job with escalating issues to HCPF. Some offices at HCPF have streamlined our processes with outstanding escalation processes to try to make our escalation process more efficient. Please keep submitting escalations through our escalations form and not to specific HICPUF team members as that could cause delays. If you have questions, please email those specific HICPUF teams. We will provide some of those emails in upcoming slides. In the meantime, please escalate to HICPUF when County DHS is not able to support or resolve a grievance, when they are not meeting timeliness requirements, or if there is no response at all from DHS. Please also let us know when a case management agency is also not following guidelines or responding. Regarding discharge planning, please escalate to HICPUF like you have been to keep us informed on when all appropriate community partners or agencies are not participating as needed, or when discharge planning efforts have been unsuccessful and the discharge team is theoretically stuck and need additional guidance and resources to determine next steps. Also, please escalate when immediate health and safety risks are present. Creative and complex solutions. This slide is geared towards newer hospital staff members just to educate you guys. Creative solutions and complex solutions were developed by the department and now run by community partners with the goal of collaboration in a cohesive group to process through high acuity discharge patients. In 2018, the department began transitioning the creative solutions process to raise specifically to facilitate these meetings as part of their care coordination activities. Creative solution meetings for children that include the members' care team and department staff in order to identify solutions for members experiencing significant barriers to care, including but not limited to difficult placements. Please continue to connect with your region's RAE to engage in these sessions. Use an adult hospital discharge issue reporting. The department has a specific form that can be used to submit escalations for difficult hospital discharges. The link is on the slide and at the bottom. Things that you can report using this form. When you need support locating medically appropriate discharge options, or discharge challenges due to PASSAR screenings, when there's delayed discharge due to Medicaid approval wait times, poor communication from different community partners, or you have the need support locating outpatient services for in-home health or behavioral health care. Please keep in mind that for Medicaid patients, we ask that you do use appropriate community partners as needed before using this link. This is an assistance, for example, when all available resources have been exhausted, but please let us know how we can help. Now, HICPUF resources specifically, just some things to let you guys know of. For our hospital website that we've been referencing a few times in this presentation, please click on that link for more details. We are routinely updating that website, so please keep checking in at least quarterly. You will find trainings, billing and payment information, community partner information, recovery and audits, and resources just for discharging patients. For escalations to HICPUF, please complete the links listed on these slides as appropriate. The top link is to file a complaint and/or escalations to report a barrier to care against HICPUF, DHS, or a community partner, or to report any general gaps in service. The report suspected fraud link is to report any provider and/or member that you suspect is engaging in fraud activities. And then the link for complex and creative supportive services. And also the link there is for hospital discharge support within the complex supportive services link. Kids Corner. This is something really exciting that HICPUF is currently working on in collaboration with the ACC Phase 3 that we talked about. We are currently working on connecting the workflows for RAISE providers and county child welfare staff to utilize between April 1st, 2025 and October 1st, 2025 to ensure youth needing residential treatment or residential facility or discharging from a residential facility will not be impacted by some of the activities of phase 3. There are different stakeholder engagement opportunities available, so please engage with those links provided to make sure that your input is counted. Also, here are some links for various other trainings that could be beneficial, which are also on our 4 Hospital website. Hospital discounted care technical support. So most hospitals have a team dedicated to support patients with the hospital discounted care, but we wanted to provide a slide that just goes over the technical support for that department. House Bill 211198, otherwise known as Healthcare Billing Requirements for Indigent Patients, establishes requirements for hospital discounted care for low-income patients. They will be given the opportunity to apply for financial assistance or charity care programs at the health care facility where they receive care, which most of you know about. Service charges will be the greater of either the Medicare rate or Medicaid base rate. Payment plans that are established to pay the bills may not exceed 4% of the patient's monthly household income. House Bill 211188 will also set rules for hospitals that limit collections against a patient. To include, providers are encouraged to send additional training topics requests to HCPF, HCPF underscore HOSP discount care at state.co.us. The link at the bottom of the slide will provide information on trainings on this topic, FAQs, and the Uniform Patient Application. They will also review patient rights to documents, decline screening form, rates and maximum payment calculator, provider operations manual, different newsletters, and then they also have an office hours with details listed on the slide if you have any additional questions. Contact information. So like I said, at the very bottom of this slide, you will see the General Health First Colorado grievance form. Please complete that if you have an escalations for HCPF, DHS, or any community partner, or want to document a gap in service that we should know about here at the department. Or if you just have general questions or want more trainings on specific topics, please email these teams directly as they can provide further guidance. Now, general resources. I would have loved to put more resources in here, but honestly, there's a ton of resources throughout the state of Colorado. So this is more geared towards resources that are nationwide or statewide. We will not cover specific local resources. Again, for those localized resources, please contact your local ADRC or AAA as they can provide that information for you. We just want to make a note that not every resource in this training is directly contracted with HCPF. There has, been some questions since the public health emergency, PHE, unwind of how Coloradans can get connected to Health First Colorado or any health insurance option. On the link at the bottom of this slide, you will be able to locate the flyers shown on the slide, along with toolkits, half-sheet flyers, printouts, and other resources. If you have patients that are worried about being underinsured, uninsured, or maybe losing coverage soon, possibly, or just want to know about secondary Medicaid options, please connect them with these resources. Everything is available at the link at the bottom of this page. Public assistance. We're going to cover some of the more common public assistance programs. On this slide, the first topic is food assistance. So there is the Supplemental Nutrition Assistance Program, also known as SNAP, which provides food distribution, which covers the National School Lunch Program and Child and Adult Care Food Program, and provides food with low socioeconomic families that meet eligibility requirements. And then we have WIC, which stands for Women, Infant, and Children. This is a special supplemental nutrition program for women, infants, and children. And I do want to highlight it is for pregnant women as well. This gives access to fresh fruits, fresh vegetables, peer support, nutrition counseling, and a few other benefits. And then CCAP, Colorado Child Care Assistance Programs for Families. This is financial assistance for child care options and support with locating adequate child care. And then cash assistance. So we'll first look at TANF, Temporary Assistance for Needy Families. This is a cash assistance program that helps eligible families with low income become self-sufficient by encouraging job preparation, work, and family stabilization resources. Eligible applicants receive monthly cash assistance payments as well as training and employment assistance. One thing to note is this TANF program does have an option for grandparents who are taking care of their grandchildren. So please contact DHS for information about that. And then adult financial programs. Um, there is the old age pension that is age based and income based. And then there's the aid to the needy and disabled, which you have to have a verified disability and be financially eligible. And then the home care allowance, which may provide financial assistance to provide care to a loved one if eligible. The benefits that we just covered, all of them can be applied for online through P Colorado. The link at the bottom of the slide will review these programs in more detail and also provide information on things that we did not cover in the slides, such as energy assistance, disability assistance, and employment assistance. And then I wanted to provide a section just on education and childcare specific resources. So first is a link to provide more information on the Universal Preschool Colorado program that just started a few years ago. And then Head Start, which also includes Early Head Start, which can help families with children under 6 locate childcare, family support programs, and help apply for CCAP. It can also help with connecting those young children with preschool options and daycare options as well. Colorado Shines. This is a Colorado state program that helps families navigate childcare. This Colorado agency can help find childcare options both in-home and out of the home, locate financial support options, provide family resources, provide resources to prevent suspensions and expulsions. They provide resources on how to plan for baby and much more. They can also locate licensed providers if you have any questions on that. Colorado's early intervention program provides supports and services to children with developmental delays or disabilities and their families from birth until the child's 3rd birthday. Early Intervention Colorado can help families learn ways to support and promote their child's development within their everyday routines and activities. Information on how to send referrals are located on the link on that slide. Advocacy. So most hospital discharge planning teams are really familiar with guardianships. So I won't go over this in detail, but I did want to highlight some different options on how to provide information to possibly future discharge patients if they question on if they need a guardianship in the near future, or if they're currently working with an adolescent who is about to turn 18 and they have questions on how to apply for guardianship or what that entails. So links to the Colorado Office of Public Guardianship, which can provide resources, is there, along with the Guardianship Alliance of Colorado and Lutheran Family Services, who has a location in the Denver area, who supports Colorado. They have an older adult program that provides guardianship services and family guardianship support. So please contact them with information. And then I wanted to also include the ARC. So the ARC has different chapters throughout the state of Colorado, but they can help with the guardianship filing process, They can help with supported decision-making affidavits and just provide information if you have any questions on that general process. And then I wanted to spend some time on going over ombudsman. So there's actually three different types of ombudsman: the child protection type, behavioral health, and then one for long-term care. On the Colorado Ombudsman Office's link on this slide, you will be able to find details of all three different categories and contact information for each. Specifically for the behavioral health, there is a general email that you can use, ombuds at bhoco.org if you have general questions regarding advocacy for those who may have a behavioral health diagnosis. And then the long-term care ombudsman. This is specifically for any older adults or anyone with a disability. And Colorado long-term care ombudsmen are advocates for residents of nursing facilities, assisted living residents, and similar licensed adult long-term care facilities. They work to resolve individual resident issues and to bring about changes to local, state, and national governments to improve long-term care. They're trained ombudsmen, paid and volunteered, regularly visit long-term care facilities. They monitor conditions of care and provide a voice for those unable to speak for themselves. You can locate your region's ombudsman, which follows the regions for AAAs and ADRCs. The link is here under Find Ombudsman. If your region is vacant and there currently isn't an ombudsman active, please email the state ombudsman and they may be able to assist you. That's CDHS_LTC for long-term care, ombudsman at state.co.us. Or again, for the long-term care ombudsman, please contact your local ADRC or AAA. Behavioral health resources, again, just like all the other resources, this is just the tip of the iceberg. So please contact your local ADRC or AAA or behavioral health providers for more resources or information. But the behavioral health reform has information on the current 7 projects, recent legislative requirements and reports, certified community behavioral health clinic planning grant application materials, and recent webinars to provide more education. The Behavioral Health Administration has different programs, including the Circle program, which is the only state-funded intensive residential program designed for people with co-occurring substance use, SUD, and mental health disorders, and which addresses clients' criminogenic risk in addition to the behavioral health needs. The COACT, the Colorado Trauma-Informed System of Care, is supported by Colorado Department of Human Services, Substance Abuse and Mental Health Services Administration, SAMHSA, Behavioral Health Administration, BHA, and local partners. The system of care in Colorado builds on existing infrastructure such as the Collaborative Management Program, detailed in House Bill 04-1451. All child and youth service agencies are involved, including the public mental health system, child welfare system, juvenile system, and educational system. And then the community mental health centers. These are 17 CMHCs for the provision of mental health treatment services to individuals and families of low income and are not covered by insurance throughout Colorado. The Criminal Justice Services team is tasked with providing program oversight, technical assistance, and programmatic monitoring of services for individuals involved in the criminal justice system. Then they have the Opioid Use Program and Services, which provides oversight of and purchases of opioid treatment services, including traditional SUD treatment and opioid treatment programs, OTPs. The BHA provides some oversight for office-based opioid treatment, or OBOT. The PASSAR, Pre-Admission Screening and Resident Review, is a federally required pre-admission screening and resident review program for clients entering Medicaid certified nursing facilities within Colorado. The state mental health authority is responsible for making the mental illness and specialized services and nursing facility determinations based upon this PASSAR requirement. And then PATH, which stands for Projects for Assistance in Transition from Homelessness, is a federal formula grant to assist homeless persons with serious mental illness. And then Recovery Support Services. This is a list of services available in Colorado to support those in recovery from substance use. Then I provided contact information for the Colorado Crisis Services. You can call or text to receive support and counseling services for anyone in active crisis. Please provide that contact information for any discharge patient as needed. And then again, if you or anyone you know needs help in this area to connect with behavioral health, mental health, or STUD resources, and you don't have the capacity or time to review these resources, please contact your local RAI for any medical or Medicaid member who may need support in this area. Housing. So for some extended stay patients, TCAs may be able to locate housing by sending a referral to HICPF through the hospital discharge barrier form. And then the TCA can also help with possibly removing other barriers as needed and or work with the CMA as needed as well to set up services in the community. But we're going to focus most of our time on MFP, which is money follows the person. In collaboration with local, state, and federal partners, the department will implement a new MFP demonstration to expand services and supports available to people who wish to live in the community. To be eligible for MFP, a person must reside in a Medicaid nursing facility, an intermediate care facility for individuals with intellectual or developmental disabilities, the ICF-IDD, or Regional Care Center, the RC, for 60 days or more with the desire to move to the community. MFP supplemental services may offer person-centered support to address social determinants of health and to help members begin to acclimate to community living while they still reside in a long-term care facility. So this would be for any or extended stay hospital patient who is discharging and will be in discharged to a nursing facility for at least 60 days, but still wants to reside in the community. The MFP supplemental services created under Colorado's demonstration will include things such as environmental adaptations to provide home modifications prior to discharge, which allows a member to enhance accessibility to their home through modifications such as widened doorways, the construction of ramps, or adaptations to the bathroom and or kitchen. It also may include peer mentorship prior to discharge, and short-term rental assistance, which provides members with rental support, including rental arrears, utility startup costs, and support with security deposits. Then MFP may also include pre-tenancy support, which helps members learn about the requirements to access and maintain community housing. And then short-term food assistance provides members with payment for food pantry items for up to 30 days following discharge. And then I wanted to talk about temporary medical respite. In suburban areas throughout the state, there are medical respite options to help those who are stable enough to discharge, but will need some oversight post-discharge and may not have a caregiver available. This would mainly be for the unhoused population. To help locate medical respite, you can complete a referral to your region's RAI, or you can contact agencies such as Colorado Coalition for Homeless or Colorado Respite Coalition. Again, this is not an exclusive list. And then housing. So I wanted to talk about the coordinated entry system. The Balance of State BOS Continuum of Care COC has established a coordinated entry system. Coordinated entry is a process developed to ensure that all people experiencing housing crisis have fair and equal access to resources and are quickly identified, assessed for, referred, and connected to housing and assistance based on the person's need throughout the entire state of Colorado. To receive these resources, the person experiencing homelessness can go through a participating agency to complete VSTAT, which stands for the Vulnerability Index Service Prioritization Decision Assistance Tool. And then last one, I wanted to cover an LTSS benefit known as home modification. Home modification is a benefit under Health First Colorado that allows for specific modification, adaptations, or improvements in an eligible participant's existing home setting. These home adaptations or modifications may include, but are not limited to, installing or building ramps, modifying bathrooms and or kitchens, installing grab bars and other durable medical equipment as part of the larger home modification program, widening doorways, modifying kitchen facilities, and possibly installing specialized electric and plumbing systems that are necessary to accommodate medically necessary equipment. Rural resources. So these are just two resources that we're going to highlight that are newer to the state of Colorado. But again, there's other resources available. One resource that you can use to locate more of these rural resources would be HTP, Hospital Transformation Project. They will have more specific information on what rural regions can use specifically. But essentially, Colorado is launching a telehealth pilot program to increase local access to health services in collaborative effort between the Colorado State Library, the Colorado Office of eHealth Innovation, and the American Heart Association. 23 rural libraries throughout the entire state will receive funding and support to implement initiatives to increase telehealth access for different rural communities. Libraries could choose to implement telehubs, which is a private space within the library that patrons can reserve to connect virtually with a healthcare provider or participate in virtual wellness services. These spaces will have the equipment and internet connectivity needed to support virtual services, and patrons can get assistance with the technology as needed from library staff and then have a private telehealth session. Alternatively, some libraries choose to implement what's called telehealth kits so that patrons who have adequate connectivity at home can borrow the equipment and connect with the provider in the comfort of their home. Please contact your local hospital to see if the telehealth kit is an option for you. And then the next one is Parent and Family Wellness Center prenatal wellness check-ins. This will be a free wellness check-in to pregnant and postpartum women throughout Colorado. This will be a 20 to 30-minute video session with a specifically trained mental health clinician to provide psychoeducation about PMADs, perinatal mood and anxiety disorders, and help folks understand and mitigate their risk factors. During your free one-on-one video session, a clinician will help identify what stressors you may have, check in on your relationships and or supports, and educate you on how pregnancy and postpartum can affect your mood. And if you want more support, we'll help set that up too. And then you can schedule a session or email if you have any questions, the following links provided on this slide. Web resources. So there's different resources available on this slide just to help with more general discharge resources. So the whole person transitional care is a hospital guide on different transitional care to discharge to prevent readmissions. And then Disability Benefits 101 is for anyone who has questions on how to apply for disability. So you can provide this resource to possibly to future discharging patients. And then Disability Etiquette Guide. So this is a reference guide on how to work with people with disabilities. If you just have any questions on the different types of disabilities or how to phrase things just to be more person-centered. And then the ideal discharge planning tool helps with patient and family engagement tools to help your team to help train new staff members or resources that you can give to families to help give them a checklist of what kind of questions they need to ask to make sure that they're comfortable with discharging and to help prevent future hospital admits. And then the Health First Colorado member handbook that has details on the nurse advice line, benefits and services, including different Medicaid programs that can help discharging members, and the member handbook, which goes over everything Health First Colorado. And then our long-term services and supports will go over everything LTSS, including different programs and projects, and how to connect with resources. Senior Blue Book, which is offered by AAA's. They go over different housing and health resources directed specifically for seniors throughout the entire state of Colorado, and then Age-Wise Colorado. This can help with general financial housing resources, social support, and support with assistive technology, just to name a few. Respite caregiver support. This is a big one, as a lot of people who are set up with caregiver support and respite have seen a decline in rehospitalization because we need to support those who are supporting our discharging members. So the Colorado Respite Coalition, CRC, provides respite resources, information, and referrals to support family caregivers accessing respite services. The CRC also operates programs to further increase respite access throughout the entire state and awareness across the state, serving all ages and special healthcare needs. Arch National Respite Network. They assist in promoting the development of quality respite and crisis care programs. They help families locate respite and crisis care services within 24-hour notice and serve as a strong voice for respite in all forums. The lifespan respite is defined in the Lifespan Respite Care Act as coordinated systems of community-based respite for family caregivers of children or adults regardless of the special need. Since the Lifespan Respite Care Program was first funded in 2009, the Administration for Community Living, ACL, in the U.S. Department of Healthcare Human Services, HHS, has funded 38 states in the District of Columbia to establish or enhance statewide lifespan respite systems, provide planned and emergency respite care, recruit and train respite workers and volunteers, and connect family caregivers to respite information. The National Family Caregiver Support, NFCSP, is the next one that we'll go over, and this was created during the reauthorization of the Older Americans Act of 2000, which also guides the work of the AAAs and ADRCs. The goal of this program is to provide services to caregivers, providing assistance to older adults as well as grandparents over 60 raising their grandchildren. Services provided through this program fall into 5 categories. First one being information to caregivers about available services. Second, assistance to caregivers in gaining access to supportive services. Third is individual counseling, organization of support groups, and caregiver training to assist the caregivers in making decisions and solving problems relating to their caregiving role. The fourth is respite care to enable caregivers to temporarily be relieved from their caregiving responsibilities. And 5, supplemental services on a limited basis to complement the assistance provided by caregivers, which may include home modifications, assisted technologies, ERS, which is emergency response systems, and possibly DME, durable medical equipment. And then the last one that we'll go over is the VA Respite Caregiver Support. So this link will give you Veteran Toolkit resources and Caregiver Toolkit resources to help navigate veterans and active service members. And then there's also the VA's caregiver support line if you have any additional questions. Again, for any resources in this area, please contact your local ADRC or AAA. Excuse me. Military support. So again, this is not an all-inclusive list, so please reach out to your local military installations because they may have additional resources, but this will just cover the surface or provide national resources that may be available on a local level. So the DoD Family Advocacy Program. This program prevents and responds to adult-initiated child abuse and neglect and domestic abuse in the military and coordinates the multidisciplinary team response to problematic sexual behavior in children and youth. Military One Source. They provide resources for active duty, veterans, extended family, and reservists. They have assistance program with legal aid, financial assistance, locating specific childcare, and more. And then they also provide support with the Exceptional Family Member Program Family Support, which could help any family who has a discharging patient who has a chronic or life-limiting medical diagnosis. So please keep that in mind. And then the Army Family Advocacy Program is the Army's prevention and response program for domestic violence, child abuse and neglect, and problematic children. They provide resources directly to the family to strengthen those families, enhance healthy life skills, and promote nurturing environments for children and youth with the goal of preventing abuse. The first Army Child Abuse Prevention Program started in 1967 and has been expanded ever since. This program responds to child and domestic abuse incidents, coordinates the community response, and provides prevention and treatment services. Commanders and community members are encouraged to be vigilant and report suspected incidents to their installation's Family Advocacy Program reporting point of contact or the local officials. But they also have prevention education, supports relationship, parenting, and resiliency skills, new parent support program, which provides in-home services for families with children aged 0 to 3. They have victim advocacy, which is 24/7 services for survivors of domestic violence, and provide crisis intervention, safety planning, and locating safe shelters. They also have training for unit commanders, just to help combat some of those abuses. And then they also do coordination of a multidisciplinary response to help with connecting medical, legal, command, law enforcement, and community agencies. And then the Soldier and Family Readiness Groups. What is the SFRG? They are command-sponsored programs helping to build strong families and bridge the gap between families and units. As SFRGs promote the commander's vision throughout the unit's mission, assist with families in becoming knowledgeable and self-reliant, and solve problems to the lowest level, including providing official, accurate command information, advocating efficient use of community resources, and reducing soldier and family stress. And then the VA Patient Advocates are an advocacy program for all veterans and their families who receive care at the VA healthcare facilities. They want to be sure that those eligible participants receive care in a timely manner. And you can definitely contact the VA Medical Center and the link provided to gain more information on that. And then VFW. Most communities throughout the state have access to local veterans of foreign wars, VFWs. And then there's the link provided shows a map of where those programs are. But in this map, you'll see Adopt a Unit program. which provides VFW posts and their auxiliaries the opportunity to adopt hundreds of military units around the nation. The Adopt a Unit goal is to develop supportive relationships with units before, during, and after deployments to help deliver the vast network of resources that VFW has available to the community. So please click on that link to get connected. Diagnosis specific resources. So a lot of times, if you just look for a specific diagnosis, their foundation or their agency, you will find either prescription assistance or financial assistance or just guidance on how to locate a support group for that specific diagnosis or just connect it with different families for that peer support. But some national programs that can also help you will be the Healthwell Foundation, and they have a specific website for the Pediatric Assistance Fund, but these are called, they have diagnosis funds where you could possibly receive financial assistance to cover diagnosis related expenses. So please click on their website for application and eligibility information. And then we have the National Organization for Rare Disorders. Again, they can provide resources for disorders that may not have their own foundation. And then again, PAN Foundation can help with diagnosis specific financial support to help cover premiums. And then one thing to keep in mind is some drug manufacturers may also offer discounts or assistance programs through their website. So if you are stuck and a family doesn't know how they can meet their financial obligation to manage some of these discharging medication regimens, please contact these organizations, those drug manufacturers for discounted care, or try to contact the hospital discount program. They may be able to help. Awesome. So thank you so much for attending this program. If you would like additional training on specific programs, ask questions, provide feedback, or share different resources that may help discharging teams throughout Colorado or those patients, please complete this training request link to let us know, and then we can try to connect you with different resources. But again, thank you so much for attending this training. I hope you have a good day.